Good morning. I am Dr. Jinlin Song, Professor. From Department of Orthodontics. I am the Dean of Stomatology Hospital affiliated to Chongqing Medical University. My research topic is effect of 3D anchorage attachment on the alleviating tipping/extrusion of premolars for en masse distalization of maxillary molars with clear aligners, a finite element study. First, the background. Transparent aligner is a kind of invisible correction. It has the advantages of beauty, comfort, convenience, hygiene, predictability, etc. It becomes more and more popular among patients. According to reports, from 2019 to 2023, the market size of China's transparent aligners is increasing year by year. While we celebrate this, we must pay attention to the unfavorable status of transparent aligners, such as low expression efficiency, bone resorption, root resorption, improvement needed in invisible orthodontic traction attachment devices. For successful orthodontic treatment, how to prevent anchorage loss is one of the critical technical/clinical problems. Although maxillary molar distalization is considered the most predictable movement in treating class 2 molars malocclusions, it depends on the biomechanical stability of the anterior arch anchorage. In particular, the molar distalization carried out with the more aesthetic and comfortable clear aligners therapy needs more precise anchorage control than fixed appliances, otherwise resulting in the mesial tipping/extrusion of the maxillary premolars and labial tipping of anterior teeth. Therefore, it is crucial and challenging to obtain the maximum or absolute anchorage in the process of molar distalization using the clear aligners treatment. With the development of digital additive manufacturing technology and digital technology, 3D anchorage attachment has been invented to cooperate with anchorage control of invisible orthodontics. However, there needs to be more evidence regarding the appropriate anatomical sites for mini implants placement that would be biomechanically favorable in molar distalization. Meanwhile, changing the length of lateral anchorage hooks could also alter the whole biomechanics paradigm and significantly affect the pattern of teeth movement. Therefore, it is necessary to investigate the relationship between force direction and tooth movement, and to optimize the position of the mini implant and the length of the lateral hook reasonably for obtaining favorable and successful orthodontic tooth movement. For 3D printing orthodontic accessories technology, our team has been researching for more than 6 years. Now we have proficiently mastered its design, production, and clinical application. Some 3D printed orthodontic accessories have not only been well validated in terms of clinical application, but also mechanical analysis. We have mastered the method of three-dimensional finite element analysis proficiently. Therefore, this study aimed to explore the optimal invisible orthodontic force system during en masse 2 maxillary molars distalization by optimizing the 3D printed anchorage attachment and the position of mini implants, while minimizing the side effect of anchorage loss. One volunteer male patient from the Department of Orthodontics, whose maxillary dentition is complete and anatomical morphology of tooth and root is typical, was selected as the subject of this study. The patient's maxillary dentition and maxillary bone were scanned by cone beam computer tomography to obtain bimaxillary DICOM data. The DICOM data of maxilla and maxillary dentition were imported into Mimic System and Geomagic Studio software to obtain parametric model. The periodontal ligament and cortical bone were modeled with an average thickness of 0.2 mm and 2.0 mm, respectively, by Boolean and offset operation in 3-matic software. 0.2 mm distalization of both first and second maxillary molars for orthodontic activation was implemented to obtain preprocessed dentition. The clear aligner model with a thickness of 0.75 mm was generated by uniformly offset outward along the surface normal direction. The personalized 3D anchorage attachment based on the center of resistance for premolars, lateral hooks, and mini implants was constructed using SolidWorks software. All materials were considered homogeneous, isotropic, and linear elastic. The elastic force as a concentrated force was applied in parallel to the occlusal plane from the bottom of lateral hooks to mini implants to simulate physiological loading conditions. After setting the above conditions, the convergence calculation of finite element analysis was carried out. Maximum resultant and vector displacement, and displacement distribution pattern of the anterior maxillary dentition on each model were analyzed. The displacement was calculated and presented in value and colorful contour bands, where different colors represent different displacement levels in the state of movement. In order to explore whether the length of the lateral hooks and the height of mini-implants could influence the orthodontic force system, 3 set of lateral hooks that was 9.78 mm, 6.52 mm, and 3.26 mm, respectively, were constructed in bottom of undercut modified adhesive surfaces. 2 groups models after assembly were constructed to simulate maxillary molar distalization, that is, with or without clear aligners, which named Model CA Hook 1-3 and Model Hook 1-3, respectively. The mini-implants were located in the intraradicular space between the first and second molars. 3 mini-implants were placed in the intraradicular space between the first and second molars with 2.3 mm vertical interval starting from a height corresponding to the center of resistance of the anchorage units. Grouping details of these models after assembling were similar to grouping in length of hooks, except the gradient rise of mini-implants height, MI 1-3, the interval of 2.3 mm. Red represents the maximum displacement and blue represents the minimum displacement. The maximum resultant displacement was observed at the crown level for 2 groups models. The distribution of the initial displacements of 2 groups models has shown that a similar initial displacement pattern. It was found that the tooth crowns in maxillary anterior region inclined mesially, while molars crowns tipping distally. For the model control, the incisors were labially tipped. The canine and the premolar exhibited mesial tipping. For the model CA Hook 1, the displacement tendencies of incisors and canines were similar to those of the control group, while displacement amount of them differed among the 2 groups. Specifically, labial and mesial tipping on incisors and canines was more significant for the control group than those for the model CA Hook 1. For premolars, mesial tipping effect on first premolars was more significant with 3D anchorage attachments for the model CA Hook 1, whereas this effect was not apparent in the control group. Conversely, mesial tipping effect of 3D anchorage attachments on second premolars for the model CA Hook 1 was weakened. Similarly, the displacement trend of root is consistent with crown. The anterior teeth were displaced labially, 0.010 to 0.016 mm, and premolars were buccally tipped for model control. However, the minimum tooth displacement along labiolingual directions was obtained with use of 3D anchorage attachments, which showed 0.006 to 0.01 mm of translation at the crown level. And the displacement of first premolars in the buccolingual directions were less significant for the CA Hook 1 group than for the model control. Conversely, the buccolingual displacement of second premolars increased for the group CA Hook 1. This shown that second premolars inclined more buccally. In the sagittal plane, the tooth crowns in maxillary anterior region were displaced mesially 0.0009 to 0.009 mm, relative to the model control that anterior teeth were displaced mesially less for the model CA Hook 1. Nevertheless, first premolars for the model CA Hook 1 were tipped more medially than for the model control owing to 2 premolars served as anchorage units. Under the circumstance of clear aligners, the initial tooth movement in different positions of the mini-implant and under different length of lateral hooks was showed. All numbers were expressed in millimeter. Under the condition of the MI3, the initial movement of anterior dentition with the length of 9.78 mm, 6.52 mm, and 3.26 mm of lateral hooks were observed. Displacement change occurred in the incisor and canine was less. However, the tipping of the premolars decreased by decreasing the length of lateral hooks. Furthermore, under the condition of the Hook 2, the evaluation of initial tooth movement in different mini-implant placements was as follows: with the declining heights of the mini-implant, the displacement pattern of anterior dentation remained little changed. The premolar displacement under the condition from different length of the lateral hooks to Mi3 was observed. With clear aligners, group CA hook 1 to 3, same movement trends were observed with the decreasing lateral hook's length. Moreover, mesial tipping of premolars progressively decreased by decreasing the length of hooks. But there was no significant difference within groups. With 6.52 mm, CA hook 2, the slight buccal tipping was observed. In contrast to with clear aligners, without clear aligners, hook 1 to 3, the displacement pattern of premolars changed significantly with the decreasing length of the lateral hooks. And numerical results of displacement for the CA hook group were almost higher tenfold than for the hook group. Specifically, with the condition of clear aligners produced a mesiobuccal tipping effect on premolars. In contrast, without the condition of clear aligners, a buccolingual torquing and mesial tipping occurred on both two premolars, which confirmed that clear aligners could improve root control. Given patient comfort and compliance, the length of hook 2 might be acceptable in the clinical application. And premolars produced relatively ideal displacement patterns in the 3D direction when hook 2 was selected. The initial tooth movement on the Z, sagittal, axis with the constant loading condition that from hook 2 to different mini-implant heights. With clear aligners group CMI 1 to 3, aligners produced mesiobuccal tipping on premolars, but change in mesial tipping was less and nearly remained constant. Buccal displacement decreased slightly as the mini-implants moved down. On the other hand, to exclude the possibility that of the premolar movement was mainly regulated by aligners. First premolar occurred mesiolingual rotation, and second premolar generated mesiobuccal rotation. In addition, numerical results of displacement for the CAMI group were almost higher 10 times and 100 times than for the MI group, respectively. Within the limitations, the following conclusions can be drawn. With the assistance of 3D anchorage attachment, anchorage loss caused by mesial tipping/extrusion of maxillary premolars and labial tipping of anterior teeth can be effectively avoided in invisible orthodontic treatment. Within the specific range, the influence of different levels of lateral hooks and mini-implants height by changing force application system in invisible orthodontic treatment on the controlled movement of the anchorage tooth is not obvious. Clear aligners treatment in this model with 3D anchorage attachments could be effective in controlling rotation and tipping of anchorage units caused by 3D anchorage attachment, which confirmed that clear aligners could improve root control movement. This is the reference. This is the founding source. Thank you.